This presentation will discuss three vision types: emmetropia, myopia, and hyperopia. It was put together by Haley Rhodes, a grad student at Grand Canyon University. In this presentation, we will take a quick review of the eye anatomy to help us better understand the differences in these vision types, discuss the type of vision and treatments for emmetropia, myopia, and hyperopia, and lastly, we will look at a study using hydropine eye drops and VRBF balance therapy to prevent and control juvenile myopia. When looking at the eye and discussing vision types, there are a few structures that you should know and understand their function. The National Eye Institute discusses how light passes through the eye. Light will first pass through the cornea. The cornea is the dome-shaped structure that is here, towards the outside of the eye, on the right side. This dome shape allows for light to bend, helping to focus the picture. Next, the light will pass through the lens. The lens is a clear structure that is located here inside of the eye. Even though it's clear, it is white in this picture. Both the lens and the cornea are going to work together to help focus the light. Once light has made it into the eye, it'll hit the retina. And the retina lines the back of the eye. The retina is this yellow piece that lines the eye, the inside of the eye. The retina will capture the light in structures called rods and cones. And these structures are responsible for transforming light into electrical signals to be sent to the brain. Emmetropia can be described as clear vision. Barden discusses how emmetropia is the term for naturally occurring vision. Individuals with emmetropia have 20/20 vision. This allows them to see clearly from 20 feet of distance. Emmetropia also allows clear vision in nearsight and foresight. This type of vision is caused by a balance in the length of the eye and the optical power, which can be seen in this picture. The light refracts to the retina in the back of the eye. Since people with emmetropia have clear vision, there's no treatment needed. Even though no treatment is needed, it is essential for individuals to visit the eye doctor routinely. Individuals with emmetropia are no less susceptible to eye disease than those with other types of vision. Going to routine eye doctor visits can help identify the onset of a number of eye diseases. Protecting the eye is essential. One way to protect the eye is with sunglasses that have appropriate UV protection. Being unprotected from UV rays can lead to cataracts, snow blindness, eye cancer, and growths in or near the eye. Other ways to protect the eye are to wear safety glasses when working with materials that can cause damage to the eye. Blue light glasses are also helpful to individuals who spend large amounts of time looking at digital screens. Excess blue light from the screens can lead to blurriness, dry eyes, and other ailments. Myopia is an eye condition also known as nearsightedness. Dr. Boyle described myopia as a refractive error, creating an inability to focus on objects far away. Myopia is caused by the eye being misshapen. This can be seen one of two ways. Either the cornea is curved too sharply or the eye is elongated. Both of these can cause an inability for light to refract onto the retina. This can be seen in the picture on the right. At the top, you can see a normal eye where light is refracted all the way to the retina. Whereas in the eye with myopia, the second one, the eye is slightly elongated and the light refracts just before the retina here. whenever it should reach to the retina. You can see this visualized here with the black dotted line. The refraction in the normal eye happens at the retina, and the refraction in myopia is seen right before the retina. Because of this, vision to the individuals often appears blurry. Individuals who have not sought out treatment often see symptoms such as blurred vision for faraway images, difficulty completing tasks that require distant vision, such as driving or reading the board at school, squinting, straining the eye, headaches, excessive blinking, and eye rubbing. Myopia is often treated with glasses or contact lenses. These lenses typically have a concave shape. The concave lens allows for light to refract to the retina. An example of how this works can be noted in this last picture on the right. So instead of it stopping before it meets the retina, it meets the retina where it should, like in normal vision. Concave lenses help the light to reach the retina. There are surgical options to fixing myopia. Some include LASIK and PRK. There are many risk factors that can lead to myopia. Individuals can inherit myopia from one or both parents. Diabetes or other health conditions can put individuals at risk. Completing extensive amounts of work up close, such as reading, writing, or extended time in front of digital screens. Also, not spending enough time outdoors. Other factors, such as attending college and living in cities, show a higher likelihood of developing myopia. Another type of vision, known as hyperopia, is often referred to as farsightedness. Cheryl describes farsightedness as the ability to see objects at a distance, but struggle to focus on things closer to them, such as reading a book. The balance and structure can be seen in the picture to the right. Either the shape of the eye is lengthened or the cornea has too little of a curve present. And this causes the refraction of the light to surpass the retina. On the top picture, I added a line to better visualize where the refraction of the light should meet the retina. We have normal vision at the top, and then what it is with hyperopia in the middle. You can see that the refraction goes past the retina, which causes blurriness. Individuals with hyperopia have symptoms of eye strain, headaches, and fatigue. When having to look at the items up close for prolonged periods of time, some individuals can also have trouble seeing in lower light settings or at night. When reading, children also have a tendency to rub their eyes in an attempt to focus. When treating hyperopia, doctors will prescribe glasses or contact lenses with a convex lens. If we take a look at the picture of the third eye at the bottom, you can see how this convex lens brings the refraction to the retina instead of past it. Other options for treatment can include LASIK surgery. If hyperopia is left untreated, individuals are at high risk of developing amblyopia, better known as lazy eye. The lazy eye can cause the brain to ignore signals from the eye. If it remains untreated, this can cause vision loss. Interestingly, children who receive treatment have a chance of outgrowing hyperopia, and this can happen due to the continued growth of the eye. So as we take a quick look at the vision types side by side on the slide, we can take note that normal vision, or emmetropia, is clear throughout the photo. you can see the waterfall, you can see the leaves on the rock clearly. In the middle, myopic vision, the waterfall is not clear, however, the leaves on the rock are clear, close vision. And in hyperoptic vision, the waterfall is clear and the rocks and leaves are not clear. She completed a study on preventing and controlling juvenile myopia using atropine eye drops and VR-based balance therapy. She hypothesized if atropine eye drops and VR BVF balance training is used effectively, then prevention or control of juvenile myopia is possible. 136 juveniles with myopia participated in this research. The control group consisted of 60 individuals. This group received low-dose atropine drops once a day, administered between 9 and 10 p.m. every evening, and the individuals were able to complete homework. However, they were to stay away from electronic devices after receiving the drops. The experimental group consisted of 76 individuals. The experimental group was given the same low-dose atropine drops as the control, but the experimental group was given the VRBF balance training, and this treatment lasted for a total of 3 years. When analyzing the results, there were some interesting finds in this first graph. She tested the naked vision before and after treatment. The y-axis shows the naked eye vision measurements. The control group data is represented by white, and the research group data is represented by green, and will be represented by the same colors in all of the graphs that we look at in this study. We can see before treatment, there is no significant difference in naked vision between the control and the research groups. However, after the experiment, you can see a significant increase in the naked vision of both groups, with the research group having more improvement than the control group. When we take a look at figure 2, there are 3 measurements that were taken before and after treatment. When looking at graph A, we are looking at pupil diameter measurements. Before the experiment, both control and research groups were similar. But after, you can see a significant increase in both groups, with the research group having the more significant increase. The graph B shows this axle length measurement from before and after, but both before and after have no significant changes with the treatment. In graph C, we see the diopter measurement, which shows some significant changes. The diopter was significantly reduced after the experiment. There is more change in the research group. Again, research is the green group, than the control group. In figure 3, we are able to analyze data from intraocular pressure and the adjust sensitivity. Graph A shows measurements of the intraocular pressure before and after the experiment. There are no significant changes in pressure before or after. In graph B, we are looking at activity sensitivity times. When comparing before and after, we can see increases in both groups after the experiment. And again, we see a slightly greater increase in the research group over the control group. In table 2, we can see the efficacy of the 2 groups, the control and the research. One area where we can note remarkable differences is in the ineffective individuals, which is the fourth row here. The control group shows that 20% of the individuals in this group were ranked as ineffective, whereas the research group only showed 7.9% ineffective. The last table that Shai put together was to note any safety issues with the experiment. During the experiment, the following adverse events took place: photophobia, near vision difficulties, and glare. While these are adverse for individuals, fewer members of the research group had them. 3.95% of the research group experienced adverse events, whereas 8.33% of individuals from the control group experienced these adverse events. In conclusion, Shai stated that LDA combined with the VR-based BVF balance training has an efficacy in the prevention and control of juvenile myopia, which can improve the naked vision of individuals. Here are the references that I used. Each reference I used information and images from. And the last reference is for the study that we just looked at by She. Thank you for viewing this presentation.